Hi, my name's Dom Orton. I approached Venka online to see if she could help me get down to the root cause of depression and anxiety issues that I've been experiencing for quite a long time.
So how did you feel before you came to see me?
So, specifically over the last year and a half, anxiety issues for me have been becoming much greater. I've found that I need a morning routine, and that if my morning routine was disrupted, even in a tiny way, so like having a coffee, if there wasn't enough milk for the coffee, my routine was upset. And I'd find that that would almost spoil the whole day for me. And it'd have a cumulative effect. I'd then reach for junk food. And if I felt bad, I'd eat badly, I wouldn't exercise, and I'd go into a downward spiral.
Dom, what other things in therapy did you try to resolve your anxiety before you came to see me?
So over the years, the first piece of therapy I had was solution-based therapy, which was provided by work through the employee assistance program. I didn't find that particularly effective. Over the years, I've then tried cognitive behavior therapy, which I found very trite and didn't work for me, and then cognitive analytic therapy. But I've also explored lots of less conventional methods, such as emotional frequency technique or tapping, and regression therapy through matrix re-imprinting as well.
Okay. And did you have any physical symptoms of anxiety?
Yeah, I think they come off the back of depression and anxiety. So I think it affects my immune system. So I was very susceptible to getting colds and flu. It would affect my digestion. I would regularly get stomach cramps, dizziness, headaches, and a lot of tension around my neck and my shoulders. And I would even imagine that I had illnesses that were worse than they were in reality. So I would think that stomach cramps meant I had stomach cancer, and I'd even go to the extreme of going to see a consultant for an endoscopy and a colonoscopy to try and see if I was right or not, which of course I wasn't, thankfully.
Dom, we had one session of bilateral analysis stimulation technique, and one which is called rapid one session of hypnotherapy. How do you feel different now, taking into account that we're in the midst of the COVID-19 virus, so it's very odd times?
Yeah, sure. It's very early days, but after that initial session, I definitely felt different. You know, we got through some very traumatic events, one of which I hadn't really thought about that deeply. And prior to that, I would feel very anxious when I was in crowds, and I would suffer with paranoia, often imagining that people in the street or on a train were a threat to me. And those feelings seem to have gone away.
Perfect, because that may have been the fight-flight response as a result of that.
Yeah.
So, Dom, what would you say to a person hesitating to seek therapy with me? Does it take many months of weekly therapy to get better?
No, definitely not. I mean, I felt an immediate benefit after the first session that I had with you. And I've felt progress in the follow-up session that we've had, and also in the recordings that I've been listening to.